I want to welcome you this evening to the Hemophilia Council of California's webinar, How to Navigate Medi-Cal, GHPP and Medicare. My name is Lynn Kinst. I'm the Executive Director of the Hemophilia Council. And again, we really thank you for joining us this evening and hope that this will be beneficial. Briefly, I do want to go ahead and thank our sponsors, Takeda, BioMarin, Novo Nordisk, Sanofi, the Hemophilia Alliance, as well as AbbVie. So just real briefly, for those that might be new to the Hemophilia Council, we are a 501c3 nonprofit that was formed in the late 80s to really coordinate the shared advocacy agenda of the 4 California Hemophilia Foundations. And our focus today is to coordinate access to care, education, and advocacy efforts on behalf of individuals living with bleeding disorders and other rare diseases. And we really advocate to protect access to care and to promote progressive treatment options, as well as to advance the quality of life for these individuals and their family members. So we've already kind of briefly touched on this. We are here to prove access to care, and our vision is open access to quality and innovative care and choice of treatment for all people with bleeding disorders. So with that, I am going to introduce Mosey Williams. He is a licensed clinical social worker at the University of California, San Francisco Adult Hemophilia Treatment Center. And Mosey, if you want to go ahead and hop on and introduce yourself, that would be great.
Thanks, Lynn. Hello, everybody. Thanks, Lynn, for the introduction. Again, my name is Mosey Williams. I am the adult clinical social worker at UCSF Treatment Center. I'm also a board member with HCC and also with the Hemophilia Foundation of Northern California, and I also have severe hemophilia A. And so what we'll be talking about today is insurance options, things that are available, and just having a discussion. If you have questions, put them in the chat, and then we'll have some time to, I think, speak audibly at the end. Yeah. So specifically Medi-Cal, GHPP, and Medicare. And so these are 3 options that are available for adults. Medi-Cal, the California version of Medicaid for the United States, GHPP, Genetically Handicapped Persons Program, and Medicare. Next slide, please. Okay, so speaking specifically of Medi-Cal, in terms of eligibility requirement, you must live in California to be eligible. There are income-based eligibility requirements as well. So, and that's available online. At a certain income level, you're no longer eligible for Medi-Cal. In terms of eligibility and age, and when we think about children that may have been on their parents' insurance, and we know that some years back that was extended to age 26. It previously was age 24. And so now Medi-Cal has been expanded so that eligibility is for adults ages 26 to 49, regardless of immigration status. So prior to, my understanding is for individuals who were undocumented up until age 26, they could still be on Medi-Cal, and now it's been extended to ages 26 to 49.
And I'll just add to that real quick, Mosey.
Sure.
So the first expansion or previous expansions made Medi-Cal available to individuals under 26 and 50 and older. And so this ages, 26 to 49 is sort of the last group that previously was not eligible, regardless of immigration status. And so that has now been expanded. So that's kind of the last age bracket to get covered.
Thank you for explaining that. And it does cover that group that was currently not eligible, previously not eligible for Medi-Cal. And we saw some of that during the pandemic, where there was an emergency Medi-Cal extended to individuals who were undocumented that were outside of the age of 26 and then less than 50. In terms of applying, you apply online at the Covered California website. And I'll just say, in looking at, having seen the websites before, when you apply, I won't say try not to get confused, but it can be confusing because you are applying for Medi-Cal and then it sends you to the Covered California website. But follow the links and you are able to apply there and online, which even from your phone, which can be more convenient than some of the other applications for the other insurances we're talking about tonight.
Yeah, and the reason for that, the reason that it sends you to the California website is because California has taken an approach to the insurance that's um they kind of one entry point, a single entry point. And so Covered California offers, potentially low cost and subsidized insurance for people who don't have it through it's our marketplace plan, right, under the ACA. And so by doing it this way, they have one application. You fill that application out, and then they come back and they tell you, yes, you're eligible for Medi-Cal, or they might say, no, you're not eligible for Medi-Cal, but you are eligible for these Covered California plans with these subsidies. And so this is what it would cost you. And it's potentially possible that you could not be eligible for Medi-Cal, but you could get almost a free or very, very low cost Covered California plan if you're sort of just outside of the Medi-Cal income requirements. So it's a definitely something to consider. And of course, Mosey is going to get a little bit more into GHPP. For people with bleeding disorders, GHPP may be a better option than Covered California. But for, it's good to look at those options. And also for people without a bleeding disorder, if you have other family members that are looking for coverage, Covered California may be a great option.
Right. Thank you. And so with Medi-Cal, most Medi-Cal patients will be on a managed care plan. And so what changes have happened with Medi-Cal? It used to be a more general coverage throughout the state where you could be seen at different treatment centers and other specialty care that provided Medi-Cal as an insurance option that could take Medi-Cal insurance. But what has happened recently is Medi-Cal has gone to a managed care model where the Medi-Cal that you have is generally based in the county that you live in. So previously, your insurance was known as Medi-Cal, and then and if someone is on Medi-Cal, you may have received a letter from the state saying, giving you choices of plans to choose from based on the counties. So if you live in San Joaquin County, they may have given San Joaquin County Medi-Cal as an option, healthcare plan as an option. And so then you were to choose. And so the result of that is the next bullet, you may be limited to specific networks of doctors and hospitals. And this can be frustrating and challenging in thinking about people with bleeding disorders, because if you live in one county, let's just say you live in Alameda County, and then your treatment center hemophilia treatment center is not in Alameda County, it may be challenging to get care, or if you saw a doctor in another county. And so as a result of that, some services may be denied that weren't previously denied. And so what can be done at this point is you can apply for an exemption that would allow you to be seen at the providers that are outside of the county that you live in or outside of the managed care plan that you have been assigned. Yeah.
So as a social worker at a treatment center, Mosey, what would you recommend if a patient gets one of those letters from Medi-Cal and they say, hey, we're enrolling you in managed care. Here's here's your choices. How would you know, like, whether or not your treatment center would still be able to see you based on which one you choose?
That's a good question. And let's just say that you live in Alameda County, and let's just say if you're an adult and you come to UCSF or even Stanford, then neither of those are in Alameda County. And so the choices you would be given would not include that. And so I guess particularly when we're thinking about primary care, you may see a primary care doctor uh, at a facility, a medical facility in your county. You would ask to be referred to the treatment center that you previously went to. Some people are approved outright and some aren't. And so um, to answer that question, depending, you may not really have choices that are based on hemophilia wise or bleeding disorder wise where you previously went. And so I would just say if you're connected to an HTC, talk with your social worker and staff. But the letters have been confusing. I had a patient where it gave them options and then it also gave a straight Medi-Cal option. So they chose that one. And I think that the letter was sent in error because then they received another letter that had two other options and then the regular Medi-Cal was no longer there. And so I called them and I kind of was frustrated, expressed some frustration. I said, look, you can't send a letter to somebody and then not explain why and then send something else and they don't know. And they were confused and anxious about the whole situation. And so if you have a letter, I would say contact your HTC and see if they can help you to make a decision. Sometimes the decisions, there may be two health plans in your county. One may have more options within the county for seeing specialty for other care, not necessarily hemophilia related, but just other services. One may have access to more doctors. So you may want to look at those and compare that in terms of what's available to you.
Yeah, and I would also note, there was a comment in the chat that, sometimes they just automatically put people into a plan and uh and so
Mhm.
in some counties there is only one plan, so they aren't going to give patients a choice. They're just automatically enrolling them in Medi-Cal managed care. And that is the type of situation in which then at that point, if you're having trouble accessing the providers that you need to see, you can request those exemptions in order to try to get access. And this is a conversation that the hemophilia council is having with the state in an ongoing way right now, to talk to them about how we ensure that these managed care networks are inclusive of the specialty care centers like the hemophilia treatment centers that we need. That could also be something that could be impacting, sickle cell patients, for example, cystic fibrosis patients, other patients with specialty needs, as well as hemophilia treatment centers. So definitely something to keep your eye on. And if you have a specific problem with that, feel free to reach out to us individually so that we can address that.
Right. And I can briefly just say, if you're automatically enrolled into one, I would say, see the primary care provider there and ask for a referral to a hemophilia treatment center regarding the bleeding disorder, if that's the situation. And then work with the HTC and they can, contact that provider and explain things and kind of help bridge a relationship. And and lastly, Medi-Cal RX is a state entity that handles pharmacy benefits, including medications, including medications for bleeding disorders. And next, and this may, for people with bleeding disorders, and we talked about the challenges of managed care, Medi-Cal, this may be an option for some people. Genetically Handicapped Persons Program, kind of antiquated language, but that's the acronym. To be eligible for this insurance, you must live in California. GHPP also is not, it doesn't consider immigration status as part of an application at all as well, but you must live in California. Eligibility is based on genetic conditions. So we have bleeding disorders, sickle cell, and other disorders too that are genetic. To qualify for this insurance, you must be 21 and over and have one of those conditions. And so thinking about a child that has a bleeding disorder, they may be on California Children's Services insurance, and then when they turn 21, they can stay on that until they're 21, and then they could roll into GHPP insurance wise if they weren't already eligible for Medi-Cal. In order to apply for GHPP, it's only by email. They don't have an online application. You have to download the application, or you can type it in. Then there's some parts to sign, and then you email it to them.
And I will note, you can also fax it, or you can fax or mail it, but we do recommend emailing as a better option from fax or regular US mail, because it allows you to sort of have a track and it's almost like a receipt of when you sent it if you need to follow up. So I think that email is the preferred option.
It is, and I can say, as a social worker, I've seen them do renewal applications very quickly, within an hour. Renewals, that is, not brand new applications, but when they're emailed to them. And also, as a patient, I remember applying for GHPP and sending my application in the mail and getting a return receipt, and that they had received it. And then months went by, and then we said, what happened? You look at the return receipt, somebody in another office at the state had signed for it, and it was sitting on somebody's desk in the wrong, so things do happen unintentionally, but when they sent the email, they get it directly. So I would recommend printing out the application, filling it out, and scanning it to an email that you send. So then you have a copy too. Yeah. And so what GHPP covers, it covers the care, particularly for the genetic condition that you may have. It allows you to be seen in hemophilia treatment centers locally, and also if you have to have a consultation at another hemophilia treatment center in California, that's covered as well, as long as it's for the same reason or for the same authorization that you have for your bleeding disorder condition. One of the differences between GHPP and Medi-Cal is that GHPP is not county-based. It's state-based, so the whole state. So it is possible with authorization and approval, pre-approval, to see a hemophilia treatment center, to change treatment centers, or to see another doctor at another treatment center if that's approved. GHPP also covers hospital stays, covers emergency room visits as well. Outpatient, covers medication, pharmaceutical services, medications that your doctor prescribes, can cover home infusion, surgeries, nutrition products, and medical foods. Now, some of these things, and like there's the stars at the bottom, the note is that each service has specific criteria for approval and must be medically necessary and appropriate to be approved. Okay, so for example, they may not cover a visit to the nutritionist. They do cover CPAP therapy if you have sleep apnea, but there may be a copay that you have to pay along with that. The key is for things that are outside of the bleeding disorder treatment, like also mental health, they do cover these things, but you have to get them pre-authorized. And the process for that is what's called a service authorization request, or a SAR. And that has to be filled out by, you fill out your part with your information, and then the provider that you're going to be seeing for the specific service. And that is sent to GHPP, and then they approve or deny. And that's how you approve to have the other services, like durable medical equipment. Like I mentioned, CPAP machines have been covered, but the CPAP cleaner is not covered. And so it depends on, the key is to pre-authorize. Generally, they do cover, the question is, to pay for all medical care? Generally, yes, but a lot of times when it's not related to hemophilia, it has to be pre-authorized. That's the main thing, is that with Medi-Cal, you can go into a facility and be seen, and then can get a approval right then. With GHPP, if you go somewhere, you won't be able to get an instant approval for things that are not related to that.
Yeah, and there was kind of a couple questions related to that. I also got a question sort of directly messaged to me, like, why would somebody choose Medi-Cal over GHPP? A couple of reasons. So if someone qualifies for Medi-Cal, they often, it's not at all uncommon for a patient to have Medi-Cal and GHPP. If you qualify for Medi-Cal, then you're going to qualify for GHPP for free. But to the point that Mosey just made, while GHPP only, and some people do have just Medi-Cal, and some people have just GHPP, and some people have both, um, while they both will cover all types of illnesses and treatments, like if somebody has a bleeding disorder and they get cancer and they have GHPP will cover treatment for them. But fewer providers are familiar with GHPP and how it works. And so it can be more challenging to find providers that are willing to accept it, only because they don't really know they don't know how it works.
Mm-hmm. Yes, that's a really good point. And that's
But
probably a longer conversation in terms of
yeah,
how they
and
see it. Oh, yeah,
we
but
don't necessarily have time for all that. But
right,
I would also add that the reason why you would potentially choose GHPP and not choose Medi-Cal is simply because you may not qualify for Medi-Cal because of your income, whereas you could qualify still for GHPP, and then you would just have an annual enrollment fee to pay. So
right. There's no maximum income with regards to GHPP, and it's just a sliding scale. They would calculate what you would pay based on your income.
exactly.
Yeah. Okay, I think okay. And lastly is Medicare. It's a federal program for individuals 65 and over or under 65 with certain disabilities. There are a number of hemophilia patients that are on Medicare, and it just depends. It may depend on the severity of their hemophilia, and if they have had. I've seen different cases where someone had multiple arthropathy and then joint replacements. They may be on Medicare. Some people have all three. They have Medicare, Medi-Cal, and GHPP. And so, yeah, it's generally for people 65 and over, but there are some patients may qualify, and that might be your situation depending on the severity of your bleeding disorder. And there are 4 parts to Medicare, A, B, C, and D. Slide. Specifically, Part A is hospital inpatient insurance. And you see there what the patient's responsible for. Part B is outpatient services, factor therapy, and you see what the copay is there. And then Part C is Advantage. It's optional plan, Medicare Advantage. A lot of people don't have this one because it is optional. I'm not aware of what the cost would be. Like I said, the cost varies. And Part D is drug coverage. So private plans contract with Medicare, standalone prescription drug plans, Advantage plans, and so yeah. Lynn, if you have anything.
Yeah, I will say that, and then I got a question in the chat, kind of talking about how do they all connect, and should you take, if you have Medi-Cal and Medicare, do you need to get Part D? And one point of clarification for bleeding disorders patients is that while Part D is drug coverage, blood factor, as we've noted on here, actually falls under Part B. And so, but just because your blood factor is under Part B, but doesn't mean that you're not going to need other prescriptions, right? There's lots of other things that we might need prescriptions for, blood pressure, cholesterol meds, some other issue that you're facing, right? And so, and you don't know when you don't necessarily know when you first initiate this process, like what conditions you might have down the line and what you might need coverage for. So it is a very complex individual decision, and it is something that you want to get expert advice on when you are at the point of needing to transition to Medicare. We're going to talk a little bit about how they work together here. So, Mosey, if you want to.
Yeah. So I guess they can work together. Like I said, some patients have one or have all three. And so Medicare, if you have Medicare, it will be the primary. You have some people have Medicare and Medi-Cal, what they call Medi-Medi. So Medi-Cal will be the secondary, and Medicare will be primary and cover costs, and then Medi-Cal can cover what wasn't covered. And then GHPP will always be the payer of last resort. So even after all of that, if there's anything left, GHPP will cover it. as a
A
tertiary, I
good
guess.
a good question was, do any of these provide out-of-state coverage if you're traveling? Have you come across that issue, Mosey?
GHPP covers emergencies out of state, but the provider has to be um, approved by, it has to be a certified provider. Like, so they have to, I think, have NPI and all of that. So hopefully there's no incident of accident, but if that's the case, make sure you go to a reputable facility, because GHPP may or may not, they may not cover it if it's not one that has credentialed providers there. And I
Right.
don't,
But
somebody else had asked me about
generally,
out of
if you're,
country.
yeah, I mean, generally, if you're traveling in the United States and you're in an accident, you're probably going to end up at a hospital that is like a certified facility. The question would come in more in a case
Mhm.
where maybe if you're just having some sort of medical issue and you think, oh, I'm just going to go to this clinic or whatever, make sure that it's like to Mosey's point, make sure that it's a reputable medical clinic with the proper
Mhm.
certification.
Yeah. I would say Medicare is federal, so they would cover,
Obviously
because
be.
it's throughout the country, and Medi-Cal, because I guess it's a Medicaid plan for California. I would think that they would cover too. I think GHPP. Well, I did reach out to them and ask them that question. They said they do, but I think that would be the one that I would not, if I were a patient in that situation, I wouldn't seek out like just an outpatient care. You have emergency, but I wouldn't seek outpatient care out of the state with GHPP. I wouldn't do it. I wouldn't recommend it, I should say.
Yeah, it's not ideal, but if you were in
Right.
emergency, you should be covered. Yes. So then there was also a question, do you need a primary health insurance plan in order to qualify for GHPP? That is
No.
no, you do not need GHPP could in fact be your only insurance.
Mm-hmm.
So there's a like we said, you could have Medi-Cal, Medicare, and GHPP. You could have, you could have Medi-Cal and GHPP. You can have only GHPP. You can also have private insurance and have GHPP as your secondary. One thing that I will note, however, is that if you have a primary and you have GHPP will not pay like your copay or your co-insurance. So if your insurance covers your blood factor, for example, say you have Profi and it's $25,000 a month for your medicine and you have 20% co-insurance, and so you have to pay, $5,000 for your every month
Mm-hmm.
for your copay until you hit your out of pocket. GHPP as your secondary is not going to pay that co-insurance. But if you have insurance and say it's really like a super basic plan and they do not cover blood factor, and so they just outright reject your request for your medicine, then that's the type of situation where GHPP would step in and would potentially cover it because it's not covered by your plan. So if GHPP is your secondary, you have to show that you are not getting that you were denied the treatment by your primary insurer.
Right. Yeah. And in the GHPP application, it asks you if this is your only insurance, what is the reason? And it could be because the insurance offered by your employer is too expensive. So it's understood that GHPP can be a primary insurance.
Yep.
Okay, and so just in terms of this being proactive, always start early, 3 to 6 months for eligibility or renewal. GHPP sends out, in terms of renewal, they send out reminders, not consistently, but they do send them out. So just be aware of when the expiration date is of your eligibility. Now, another thing is they don't accept applications earlier than 2 months prior, as far as a renewal application. And so if you start 3 months ahead and get things ready, basically you just need your tax information. You need a copy of a bill where you live and your driver's license, and just making sure you have your taxes done, or W-2 information for them. That's basically what you need along with the application. Consult with experts. we're here to share and answer questions, but also, don't always have everything right. I'm learning as we're here today as well. But we're people that will look and find the answer and continue to, talk to your HTC, and you can also talk to other brothers and sisters with bleeding disorders too, and see, their experience in navigating these systems.
Yep.
Complete the application fully and document everything. Yes, that's the main thing. And I think that's why I think scan and email is the best way, because you have it there. Because if you do all that work and you send the thing in the mail, and it may get lost, and that's your only copy if you didn't make a copy of it. So I would just say scan it, so that way you have the original, and then you email it. And I tell our patients, you can email it to me, so then I have a copy too. And then, in case, something comes up and they didn't receive it or got lost, then you can easily just send it right back.
Yeah, exactly. Document everything. There was a question how to apply. We will pull up, there's a website where the application is. And Andrea just stuck that in the chat. That's where you can download the application. And if you do have a hemophilia treatment center, usually there's, the folks on the team there that can help you navigate that process. You can also always call HCC. Most common reasons that applications are rejected or take longer to get approved is because people, don't include some of the information that's been rejected. They forget to sign something, so just double check that your application is complete when you submit it, and that usually will streamline the process.
Right. And remember, the renewal process is a lot quicker than the initial application. The initial one can take months because they've got to get information from your provider and confirm diagnosis and those kind of things. But once you're already approved, then the next year it's really quick, because it's just checking your income, and then if it's changed, and they'll change. They may or may not change the enrollment fee based on how much it went up or down. And again, about the application process, Medi-Cal is online, Medicare is online, but GHPP is not. In terms of experts, I don't know if I'm an expert, but we're here to do the best we can to give you the information that we have as it is today. Healthcare navigators are good too, particularly for community health center and other centers have them. Some treatment centers do as well, helping with insurance and things. Hemophilia Council of California, where here we are with Lynn, and then there's another website, mypatientrights.org. And as I kind of was saying earlier, coworkers, friends, family, because some people have been navigating these systems and know ways of working through things and can explain things better than I can in some situations.
So just a couple more resources here. And this is mainly, these are links that will be available when we post all of the information, how to apply for Medi-Cal and GHPP and Medicare options, etc. The Hemophilia Federation of America has some really great resources, particularly on Medicare and insurance terms. So you can always document and go to their website for more information on those resources. Briefly, I just want to mention our sponsors again and say thank you to them, but I know we're just a little bit over time, but if anyone does have further questions that we can answer, we'll stay on the line here for a few minutes. Feel free to put them in the chat or unmute, and happy to answer any other questions that folks have. Well, thanks everyone. If I don't have any other questions, we will sign off. Oh wait, here's one in the whatever insurance changes during the application review to apply for GHPP. So if you submitted an application and it had, you knew you had certain insurance and you included that on the paperwork, and then that changes, this is another reason that it's great to be able to submit your application via email, because then I think it's really easy for you to follow up on your application, maybe even resend it and say, hey, this, I know your review of my application is still pending, but this change just occurred and I wanted you to have the latest information. Alternatively, you could wait until you hear back from them in terms of, what your insurance was. And when you hear back from them regarding like your approval, you do definitely want to provide them with the updated information, They will sometimes ask for documentation that your previous insurance is no longer active. You usually get a letter in the mail when that happens that you'll want to keep and show them, and then provide the information for the new insurance. The reason why that is important is because, like we've said, GHPP is always the payer of last resort. So they will expect your whatever insurance name you gave them as your primary to be the one taking responsibility, or they will want documentation that that insurer has rejected your claim. And so if you don't have that insurer anymore, you want to clear that off of your account. So hopefully that makes sense.
That's all the questions. So if the patient is referring to a document not legal, they can still apply to Medi-Cal between ages 26 and 49. And for GHPP2, yes, that's correct.
That is correct. They do not ask for any, they ask for information that would show your residency, like where you live, just in.
Oh, you went on mute. Okay.
Yeah, sorry. The dog was going crazy. I apologize. They will ask for something to document where you live, just to show that you're living in California. So it's not about showing immigration status or like legal residency. It's just about showing like, here's a phone bill or a utility bill or a rental agreement that shows that you are residing in California.
Right. If you apply for GHPP, there's a space for like social security number, but it's not required. So
correct. Yeah, they will just, you can just leave it blank.
You don't have to put it. So if we lose our primary health insurance during the course of the year, the GHPP automatically becomes a primary. You probably should notify GHPP so they know, but it can be the primary at that point.
Yeah, it would default to that, but you will have to notify them for the reason that I was explaining before.
Mm-hmm.
Because otherwise they wouldn't know. All right. Any other questions? Wonderful. Well, everyone have a great evening. Thank you again for joining us. This is our last webinar for 2023, but we will pick up our webinar series in January. So we hope that you'll join us again early next year and just continue, finding these opportunities to learn beneficial.